I'm the program director at Cancer Support Community South Bay. And today's program is presented by the South Bay Survivorship Consortium. And this is a collaboration of healthcare providers and not-for-profit community-based organizations who work together to bring quality education to cancer survivors. And with all of our programs, we are recording tonight. Tonight's program focuses on the power of sleep after cancer. We're going to be talking about why sleep is so important, and Dr. Asher is going to share strategies to enhance sleep without medication. So just a little bit of Zoom etiquette. All of your microphones are going to be muted during the presentation. And if you have a question during this presentation, please use the chat function and type your question in the chat box. And then we'll address your questions at the end of the program. Instead of a sign-in sheet tonight, we're using the participant list that you'll see on the screen. And so if your login name is something creative, such as a nickname or a phone number, we'd ask you to either rename yourself or let Brittany Rudanica know by emailing her, and I'll put her email in the chat box. Also, instead of a paper evaluation tonight, we are going to have a pop-up evaluation. There's only a few questions and it should take just a couple of minutes, but those answers are really important because they also help guide us in terms of what workshops you would like to see next. And all of those answers are confidential, so no one's going to be able to see your individual responses, including us. And then the recording of this program, it's going to be available in approximately 2 weeks on the web page, which is, I'll put that in the chat box as well. It's torranceMemorial.org /SBSC. And so the link to the program will be emailed to you if you registered with your email address and we're able to identify you. Let's see. The next program that we have scheduled coming up, we don't have the exact date yet, but we're looking at a June-July timeframe and focusing on navigating cancer legal and insurance resources. So be on the lookout for that. And I want to now introduce our speaker. So tonight we're so pleased to have Dr. Arash Asher. He is the Director of Wellness, Resilience, and Cancer Survivorship, and an Associate Professor of Medicine and PM&R at Cedars Sinai Samuel Ocean Comprehensive Cancer Institute. So thank you so much for being here tonight, Dr. Asher.
Okay, thank you so much, Nancy, for the opportunity to talk about one of my favorite topics. And, this is, of course, the idea of sleep. I believe that this is a birthright for us, right? That it's one of the pleasures that I think we all should work towards optimizing as best I can. I know often there are struggles either during treatment or its aftermath, and for some of us maybe even before. I'm going to try to convey two primary ideas: why sleep is important, and then in the second piece, some strategies that don't involve medications that we can optimize our sleep patterns. So just to start with the basics, and I think many people already have seen some image like this, but it's really conveying the idea of how much sleep do we need. And I know most of us have heard the number 8.5. The reality is there is variability based on our age, based on our genetic predispositions, and maybe where we are in our recovery, right? If you're recovering from surgery and chemo, we may need some more sleep. But most estimates for, let's say, adults will say something in the range of 7 to 9 hours. More recently, and this was from a study that just came out a couple of years ago, it's been shown that maybe 7 hours might be in the sweet spot of optimization, but we'll talk about that. Now, how do you know if you're getting enough sleep without putting yourself through the rigors of a sleep study and a sleep test? And I would argue there's two basic tests. Number one, if you are feeling drowsy, particularly in the morning. So if you're listening to, let's say, a boring lecture, right? Or something you imagine that was boring, and it's 10 o'clock in the morning. If your head is kind of dozing and nodding off, almost by definition, it means you're not getting enough sleep, either the quality or the quantity of that sleep. So even with boring activities, if we're feeling drowsy, you're probably not getting enough. Idea number two, if when it's nighttime.
Yeah.
Okay, and so the second way of knowing if you're not getting enough sleep, and this is a basic practical tool, is if you put your head down at night to go to sleep, if you fall asleep within a minute, right? And we've all had that experience, right? Where the second our head hits the pillow and we're out, then for the vast majority of cases, it probably means you're not getting enough sleep the previous night. So those are two easy ways that don't involve extensive testing. If we're extensively drowsy during the day, we're probably not getting enough sleep. And number two, if you fall asleep really quickly at night within a minute or two, you're probably not getting enough sleep. Now, how much sleep do we need? And like many things in human biology, it seems like there's this U-shaped curve. And by that, I mean, in the case of sleep, if we're getting very little sleep, it seems like there's a slight increase in the risk of cancer-related poor outcomes if we're getting, let's say, 4 hours of sleep or 3 hours of sleep a night. Or in the case of all-cause mortality, again, it seems like if you're getting 3-4 hours of sleep, there might be a slight increase in all-cause mortality. Or if you're getting a significant amount of sleep, like 10 or 11 hours, there may be some risks as well. Now, some sleep experts will say there's nothing inherently wrong with sleeping 10 hours. If you need 10 hours, you need 10 hours. And that maybe that risk really has to do with comorbid conditions that's requiring that much sleep, and that's what's really driving a higher mortality rate. So you may have advanced dementia, for example, that's that may be associated with longer sleep, but it's not the sleep itself that's associated with the higher mortality rate. But the bottom line, I would just say that it seems that for most of us, something in the 6 to 8 hour range, that's what you see around here, probably is going to be in the optimal zone as a goal. Now, that said, it turns out that if you look at most population studies in the United States, at least 70% don't get at least the recommended 8 hours. It's pretty well established that if you go back 100 years, most Americans slept 9 hours. And of course, if we had a chance to discuss it as a group, I asked you like what happened over the last 100 years. So even before the iPhone and the computer screen and whatnot, sleep duration began to decrease. And of course, it was because the light bulb, of course, wasn't readily available. And I have this great fortune of having one grandparent who's 103. So I actually asked her this question, and she kind of conveyed the same idea that once the sun set, people just went to sleep. There wasn't a whole lot to do. It was kind of burdensome to light up the kerosene lamp around the house. So people just tended to sleep more because of how our clocks were wired, and we didn't have all these artificial lights. We'll talk about that a little bit more. Today, about 75% of Americans have sleep issues at least 3 days a week. These numbers are staggering. There were 56 million prescriptions for sleeping pills in 2010, right? Something that just didn't exist 100 years ago. And there's a lot of associations of lost productivity with this. Now, for the cancer experience, I don't have to tell everyone in this Zoom room what are the factors that are associated with sleep. I'm willing to guess that most of us here are struggling with sleep at least sometimes. And the reasons, again, I don't have to tell you. It's either worries or anxieties or pain or Some of us may be on steroids that may cause insomnia, or some of us may be having hot flashes or night sweats. All of these things can contribute. But whatever the cause may be, it seems that poor sleep is associated with all the things that you see before you. We already talked about being tired, but it turns out that if we're not sleeping well, our memory may be impaired. We'll talk about that in a moment. It may lead to high blood pressure, may lead to depression or anxiety. It may lead to higher risk of obesity. And as we'll talk about, there's some mixed studies, it's not clear, that it may be associated with a higher risk of cancer. And this term that you see bolded, the cytokines, that's a medical term for these inflammatory compounds. And I think many of you have heard of this idea that chronic inflammation, right, probably is not helpful from a cancer perspective, from a metabolic perspective, for a cardiovascular perspective. And it seems that having chronic insomnia may increase our inflammation levels. So yet another reason to optimize things. Many of you are familiar with the term so-called chemo brain, right? Or some kind of call it cancer-related cognitive impairment. That's kind of the more medical term. All this graph is showing is that you'll see a pretty steady association among individuals, cancer survivors that had no sleep issues, and the incidence of cognitive issues or chemo brain symptoms, so that would be 20%. But as soon as you start having some insomnia, so mild insomnia was associated with a 43% rate of so-called chemo brain, moderate insomnia almost 60%, and severe almost 70%. And again, the reason again I'm showing this is I realize chemo brain type symptoms or cognitive issues are a big concern for many. One of the first things I try to focus on if I see this in my clinical practice is looking at our sleep. Because what this graph basically is showing is there's a lot of overlap between how well we're sleeping and how well we are doing cognitively. And another analogy is it turns out that sleep may also impact our metabolism. So one thing I ask about when individuals are trying to lose weight, if they're struggling with obesity, is I'll ask how much sleep they're getting. And that's what basically this graph is showing, is this inverse relationship between over the decades. We used to get, again, I suggested about 9 hours. And this is showing that we've gone from getting, as a society, 9 hours of sleep a night to 6 or so, or 6 or 6.5. And you could see while the number of hours per night went down, the obesity rate just has gone up. And it seems to be, at least there seems to be an association. There was this really interesting study. I don't have a graph for this. I'll just verbally articulate this to you, where they had a group of overweight adults come into the hospital, basically. And one group, and they gave them identical diets. So the calories and the amount of protein and carbohydrates and fat were identical among both groups. But one group was allowed to sleep 8 hours per night. The other group was just allowed 5 hours. And what was amazing is that the group that was allowed 8 hours of sleep a night lost fat, which is kind of what you want to do, and maintained muscle mass. And the group that only had 5 hours of sleep, they lost very little fat. They were losing muscle mass, something you don't want to lose when you're on a weight loss program. So it seems like sleep is optimizing our metabolic function as well. Now, if we think about sleep and cancer, I think it's worth talking about night shift workers for a moment. And I was a night shift worker when I was in the hospital as an intern or as a resident. Some nurses, factory workers have all had to do night shift work. It's relatively common in different portions of our society. It turns out that night shift workers have higher rates of breast cancer, colon cancer, prostate cancer, endometrial cancer, probably others. And then the question is, well, then why? Like, why would working at night and trying to sleep during the day, what does that have to do with the higher cancer risk? And I'm going to talk about what you see here, but it turns out, again, it may have to do with these cytokines, these inflammation markers and immune function that seems to be altered or mucked around with when we're working at night and asleep during the day. But the evidence has gone to be so substantial that now the WHO considers night shift work as a, quote, probable carcinogen. That's the amount of evidence that we have. So what's going on here? Why would this be the case? Well, as many of you know, we all have a clock. They call this clock our circadian rhythm because right, circadium is from the Latin about a day. And right, our body, our physiology needs some way of knowing what time it is because it regulates basically every cellular function throughout our entire body and nervous system, right? Even though the master clock is in our brain, it regulates the clocks in every cell of your body. So this is really, really important. And the question is, if we do have this master clock, how does that master clock know, how to regulate time? And it turns out that it's exposure to light during the day and darkness at night. That's the primary driver regulating this clock, this hypothalamus circadian master clock that we have. So for hundreds of thousands of years, maybe perhaps millions of years, our clocks and our circadian rhythm was regulated by having light during the day because we were out chasing buffalo and gathering nuts and berries and foraging for food. And then when the sun set, it was really dark. It still is in a few places. I don't know if you've been to, camping in Death Valley or Joshua Tree or somewhere far out in the desert at night. When we're here in Los Angeles or an urban area, it's hard to remember how dark the night sky truly ancestrally was. It's just we have all this light pollution, right? This is what we have to struggle with now, where we have street lights and iPhone lights and TV lights and LED lights and all these lights coming at us at night that we now know, and I've been talking about this for 10, 12 years, but there's more clear evidence that it is dysregulating our clock, and that clock dysregulation, one, seems to be associated with a number of health issues, including maybe increasing the risk of some cancer types. Now, this article, I know it's gibberish. I promise I'll put it into English for you in a moment, so bear with me. And I'll walk you through this. This just came out a couple of months ago. Fascinating study published in Nature, which is a really prestigious medical journal. They looked at almost 85,000 Brits, right? So this is a UK study where they had them wear this device that was able to measure the light exposure that the subjects were exposed to. And so they had their light exposure measured accurately over a 2-week period. And about 2 years later, they came back and assessed how much of an incidence these adults had for depression, generalized anxiety, post-traumatic stress disorder, bipolar disorder, psychosis. What this first table is showing, and I'll put the numbers out in a more legible way in just one moment, if you bear with me. What it's basically showing is even when you corrected for your job and your physical activity and your sex and your ethnicity and all these variables that they had in their statistical analysis, when you looked at those individuals that had the most night light exposure, you could see they had higher levels of depression, anxiety, PTSD, bipolar psychosis. And then the opposite, the more daytime light exposure you had lower rates, again, depression, anxiety, PTSD, bipolar psychosis. And just to put it into plain readable numbers, these were the data for individuals with and I'm going to leave this up for a second because we know anxiety, depression rates are off the charts. If we're going to have an honest conversation about this, not just in an oncology setting, but among our teens, among our young adults, it's epidemic, right? 1/3 of our teenage girls are seriously considered suicide. These are really sad numbers to read about, and you can't argue about the facts. Those are the facts. We know that that data is true. What's debated is the why. And I think there's a multitude of reasons, but again, I want to read this to you. For individuals with the most nighttime light, which means, again, your teenage or even ourselves, our teenagers looking at these iPhones all night long to be up on TikTok and whatever else they're on, 30% higher risk of depression and self-harm, 20% higher risk of a generalized anxiety, 20% higher risk of psychosis. And independent of that, the more outdoor light exposure you had during the day, 20% lower risk of depression, 30% lower risk of PTSD. I do not believe these are negligible numbers. Again, it's not a cure, right? I didn't bring the risk down to zero, but 20, 30% is at least something that we still have some agency and control over. Now that's having to do with light, dark exposure and our mental health. Let's go back to the oncology discussion for a moment. And this is a little bit more on the fringe, provocative side. So bear with me and take this with a grain of salt. But let me walk you through this. This is kind of an image from a study looking at the worldwide breast cancer incidence rate across the world in 2018. So the darker the blue, the higher the rate of breast cancer, the lower, the lighter the blue, the lower rate of breast cancer. Pretty easy to see. So North America, like US and Canada, Argentina, essentially all of Western Europe, Australia, higher rates of breast cancer. And then other parts of the world generally had less. And of course, there's a multitude of reasons for this. I'm not trying to say that we're going to simplify the reason for why there are variable rates of breast cancer across the world due to one factor. But as you look at this, I also want to then show you an image of Earth at night and the electric grid. And of course, this is showing, where there's more light at night. So this is like, the urban areas of the United States, Argentina, Western Europe, the urban areas of Australia. And as I toggle back and forth for a moment, at the very least, I think we could agree that there is an association, right? Association, as we all know, does not prove causation, but it does open the door for asking the question of, does exposure to excessive amounts of light at night contribute to some cancer types, including breast cancer? Because remember, we already had preliminary data from our night shift workers, right? We said that they're out working all night, exposed to bright light, and then trying to sleep during the day. So their clocks, their circadian rhythm is altered. Now, that said, more recently in 2017, there was a more rigorous study. This was called the Nurses' Health Study. So they had all of this incredible data from these nurses around the country. And they basically plotted the home address of all the women in the study that had breast cancer. And that's what you see on the top. And then they basically correlated it with, again, what I just showed you, a map of the amount of light at night throughout the United States. And what they basically showed in a statistical way was, again, another piece of evidence that there's correlation. Doesn't prove causation necessarily, but it does beckon us to at least wonder about this. And I could tell you that there's been, since then, animal model data where you can control everything very rigorously, showing that you can cause breast tumor growth by exposing them to artificial light when they should be having darkness, and then darkness when they should be having light. So, and that's actually what this image is. I know it's a kind of a medical slide, and I don't mean to bog us down with all the jargon and the details, but what this is showing up top, if you could see my arrow moving around, is DLEN stands for light at night, and LD stands for standard lighting. And these were an identical breed of mice having been implanted with identical breast tumors. And what you can see, I hope with your naked eye, you don't have to be a scientist to see this, is the DLEN group, the group that had their clocks mucked around with because of artificial light. You could see the tumors grew much more quickly than the group that had the same tumor implanted, but they were able to maintain normal exposure to light and darkness. Again, if there are questions about this, I'll be happy to take this in a few moments during our Q&A. So the next slide is intentionally overwhelming. So this is not meant to convey information other than to suggest that understanding the relationship between sleep and cancer is really complicated. And there's a whole host of variables. And I'm not showing this to go over all this, but again, to highlight some of the key ideas, when we're not sleeping, right, number one, it seems that many of our hormones and our metabolic pathways are impaired. And it seems that I talked about inflammation. Our inflammatory compounds may be altered. I'm going to talk about melatonin in a second, because when you muck around with your clock, like we've been talking about, melatonin's not released naturally like it should be. So we'll try to break this down into actionable strategies. The only reason I'm showing this is to remind you, this is really complicated and there's a lot more work to be done. But I think what this highlights is, thankfully, over the last 5 to 10 years, there has been a lot of research to show this association. But remember, it's a two-prong issue. Number one, are we getting enough sleep? And again, it varies from 5 to 8 or 9 hours, but it seems that 7 might be ideal for many of us. And then number two, what are we doing to optimize our clock? And that's what I want to talk about in the next few moments. How do we, if I am struggling with sleep, how do I try to cope with this right now? And the first thing I want to say is, if you have a medication that your doctor is prescribing and overseeing and it's working for you, I am not here to take that away. So if it's working, consider it, I guess a blessing for you if it's working without side effects. I just want to share some caveats. So number one, when people ask about sleeping pills, not all, but many of these medicines suppress REM. REM, as some of you may know, is a stage of sleep when we are dreaming, and that's our dream stage. And it seems to be important for cognition and memory pathways. So if we're struggling with cognition, that may not be an ideal phenomenon. We have to realize that some of them may be habit forming. And again, we may decide that the benefits are worth the risk, but at least be aware of this. And then 3, the reality is, if you look at the studies critically, it seems that 50% of the benefit of sleeping pills is just the placebo effect. So it's just the fact that I'm taking something that I think is helping is actually the real benefit. And then, of course, we've all heard about the drowsiness during the day, the falls, the cognitive issues, the sleepwalking. All these things are potential side effects. So I'm going to leave it to you and your doctor to discuss which med and the benefits and risks, but those are just some general considerations. I really want to spend the next few minutes thinking about what we can do to manufacture the best sleep naturally without pills and medicines, because the pills I'll leave to your own docs. So this is, I think, why we're all here, right? To think about what we can do. So number one, let's start with common sense stuff. And I start with the common sense stuff because I realize we may sometimes forget the easy things that can really optimize sleep. So be cautious with caffeine. Caffeine can be a great tool for some of us because it improves fatigue by blocking where adenosine binds to these fatigue receptors in the brain. But when we have it too late in the afternoon, it can really interfere with our ability to sleep. Remember, caffeine has an average half-life of 5 to 7 hours. So that basically means if you have a cup of coffee at 4:30 in the afternoon, half of the caffeine is still going to be in our system at 10:30 when we're presumably trying to sleep. So be cautious. I would recommend, if you're going to have coffee or caffeine, to have it in the morning before noon, so that some of this is still not in your system when it's really time to go to bed. Also, remember, decaf does not equal non-caf. A cup of decaf still has 20-30% the amount of a regular dose of coffee. So if you have, let's say, 3 cups of decaf, assuming that it's not going to impact your sleep, that's as if you had a cup of coffee in the evening. So be cautious about that. Second idea, and I know that, again, we're starting with just the common sense stuff, but most of us live very busy lives, and we're going from medical appointments to being on social media, to having work responsibilities, childcare responsibilities, family responsibilities, errands, traffic, and all the rest. And so like it feels like we're going 100 miles an hour all day long. And this idea that we can be wired all day and then expect to fall asleep without some kind of ritual, I think, is far too simplistic. And for those of you that have had children, I think we could all agree that when you have a baby, right, you don't just, when it's their bedtime, just kind of toss them in the bed and just have them go to sleep. You give your baby a warm bath, you read them a story, you may rub their back, you give them like a wind down period, and then, you try to put them to sleep. And I think the same really needs to happen for us, where we need some wind down period. And I just left some suggestions on the screen. You could pick what works for you, of something to do as a ritual to help, again, with our sleep process. And again, this is another medical slide, just highlighting the idea that we need to regulate, the medical word is our circadian rhythm, because it's not only critical for helping sleep, and this is a study that just came out in September 23. So this is David Spiegel from Stanford, a very prestigious group. So we need to optimize our circadian rhythm, not just for sleep, but you see the next words, because of the possibility that it may have some implications for cancer progression. So how do we do that? And I hope I made the case. Rule number 1 related to this is to darken our bedrooms, turning off our screens, our computers, and there are LED lights usually, right? LED lights are wonderful because they're environmentally using less energy. And during the day, it's great for brightening up our rooms. But unfortunately, at night, I no longer believe that it's helpful and that it may actually be causing some harm. So it's a double-edged sword in that way. So, but I would try to reduce the amount of light you're getting from computers and iPhones and LEDs at night as much as possible. If you've ever been on a nice vacation and stayed in a nice hotel, I'm willing to bet that you slept better. Part of that, of course, is because you're on vacation and you're more relaxed, but I'm willing to, bet that that nice hotel you stayed in had really thick blackout shades. Because these hotel chains know if you want your client to get a good night's rest, you're going to invest in good blackout shades. You deserve the same for your own homes. So if you don't have it already, because we don't realize how much of the street lights, the neighbors' lights, and outdoor light pollution is kind of sprinkling into our bedrooms. Blackout shades will really make a big difference. From the New Yorker, I'm sorry, am I reading too brightly? Again, I think we just need to take stock of how much artificial light we're exposing ourselves to over this last generation at night. Now, the other side of optimizing sleep is increasing how much blue wavelength light we're getting during the day. And just to get us all on the same page, I know many of you are already familiar with this. When we have exposure to natural light in the visible light spectrum, it turns out that light has a spectrum in terms of their wavelengths, from the red spectrum to the blue, which is the shorter wavelength. It turns out that having exposure to blue wavelength light during the day may actually improve our sleep and improve our cognitive ability. The best way to get blue wavelength light is to go outside, right? Remember that study I showed you earlier about lower rates of depression, of anxiety, of PTSD, of psychosis for those individuals that had the most natural light during the day. And by the way, these are things I learned relatively recently. I used to think, okay, I'm just going to sit by my window and I'm going to get my light exposure. It may be nice to look at, but it's not giving us the blue wavelength light through our eyes, which is what we need. Similarly, if we're outside and we're wearing dark sunglasses, it's also not going to give us that wavelength of light through our eyes that we need to regulate our clocks. So ideally, unless you have an eye condition that your eye doctor needs you to wear sunglasses for, we need to be outside, exposed to natural light without our sunglasses. And by the way, morning light, when it's less intense, counts. A cloudy day, right? A cloudy day would still work perfectly well. Just to give you an analogy, if you go to like a bright department store that's really brightly lit up, you may get 4, 5, 6,000 lux of light. That's the measurement of how to measure its power. When you're outside on a cloudy day, like we've had in Southern California for the last few weeks, you're going to get 100,000 lux. Right, just it's a drop to an ocean compared to what we get in our rooms. If you're out on a sunny day, you get 300,000 lux. So natural light would be the best during the day. If you're unable to, for whatever reason, that's when LED lights during the day may be the next best option. Some considerations with blue light. Again, if you need to get it from your home because you can't be outside, consider getting like a 40 lux LED light bulb, because it's not 100,000 or 300,000 like I said you get from the natural outdoors, but at least it's much better than your typical light bulb. But the best way is just to go outside, to spend a little time outside. And again, it's the reverse. At night, you want to try to block out the blue wavelength light as much as you can. So you want to turn off your screens. Some people resort, if they have to be exposed to light, to get these blue blocking goggles or lenses. You can get these on Amazon or whatever. If you have to be on your computer, there's a free download called f.lux. And what it basically does is, based on the time of day, it will make your screen brighter or dimmer based on what time it is. So it'll automatically regulate the light output based on the time of day. By the way, your iPhone or whatever you're using has a similar feature. They call it the night shift feature, right? Because the engineers at Apple also knew, they're not blind to all this research that's been coming out, that you don't want to be exposed to all that bright light at night. So there's this night shift feature under settings, and that could also minimize how much bright light is coming to your eyes at night. Okay, the next idea, and this is a pattern that I think many of us fall into when we go through a stressful time, and I want to go over this. So what happens invariably to all of us is we're having, let's say, a stressful time, right? We're in the hospital, we're waiting for our blood test results, our MRI results, we're worried. The normal human response to worry is to not sleep well. And I get that. That's natural for all of us. And we're not sleeping well. We wish we were sleeping, but we're not. So we're tossing and turning. And we're tossing and turning for a while and become frustrated. And when you're frustrated, when this happens for a few days, what happens is the next night, if this has been going on for a few days or a few weeks, you just think about going to sleep the next day. And what happens is those same feelings of negativity and frustration comes up again, even if the stressor has kind of passed us. And what happens is then that leads to worse sleep, which then leads to more worries. So this cycle that I'm trying to describe happens much more quickly to most of us than we might realize. And when that happens, and I know this next slide is just meant to be a joke, but I think it happens to most of us where the following, I'm going to read it. It's not that I can't sleep. I just really need the time to consider every possible thing that could happen ever. So we begin to associate, like when we put our head down at night, that's when the light goes off and my thoughts start racing. And I'm willing to bet that this happens to many of us when we've gone through a stressful period of time. So the question is, how do you break that cycle? And one option is to say, okay, I'm just going to take a medication to knock myself out. And of course, that might be an option for some. But there's other strategies that don't involve medications. And what I'm about to share is called stimulus control therapy. I'm not necessarily suggesting this if you're in the middle of surgery, chemo, and radiation, because this is kind of hard to do. But if you're done with that active phase of your treatment and you're in that pattern that I just described, this exercise may be really helpful. This is how it works. So number one, and I only say this part tongue in cheek, you want your bedroom to kind of look like this, right? And I only say this partially jokingly because you want your work piles away, you want it to be a serene environment, you want to begin to have that wind down period in your own bedroom. Number two, you only go to bed when you're sleepy. You don't watch TV or read or eat or worry while you're in bed. You only use the bed for sex or sleep. And then this is the hard part. When you go down into your bed, and if you don't fall asleep within 15 or 20 minutes, you need to get out of bed, go to the kitchen or the family room, and just do something relaxing. You don't watch TV or turn on the lights or do things off your to-do list. You do something kind of relaxing, like meditating or breathing or praying or whatever it may be. And then you go back to the bed when you feel like you can fall asleep. But again, if you don't fall asleep within 15, 20 minutes, you're back into the living room. And you do this as often as necessary until you sleep throughout the night. And even more challenging than that is you still set your alarm to wake you up at a set time every morning. And maybe even more challenging still, you can't take a nap during the day. So this is hard. But why does this work for many people? And I think there's two reasons. Number one, if you did this and it took you until 3 o'clock to fall asleep and you still forced yourself to wake up at 7 and you didn't let yourself nap during the day, the next night you're going to have a lot of sleep inertia to want you to get you to sleep and stay asleep through the night. So that's one reason. But if you think about this on a psychological level, what happens is you're learning to train your brain that the bed, and when I put my head down on the pillow, it just thinks of sleep. It's not the racing and thinking and worrying anymore. That's now in the living room or the family room now. So you're training your brain subconsciously to associate the pillow with just relaxing sleep. And I think those are the two reasons why this strategy may be effective for some. This is part of a greater strategy called cognitive behavioral therapy for insomnia. Virtually every sleep expert now will tell you that this is the number one treatment for insomnia over medications. And it includes a number of strategies that I'm not going to get into today. One of them was the stimulus control that I talked about, but there's relaxation and sleep hygiene and cognitive restructuring, which I don't have time to get into. But I do want to say that you can either work with a therapist or there are online programs that are rather inexpensive that you can do on your own. If you just go to Dr. Google and look up CBT insomnia online, the Cleveland Clinic has one, and there's another one called Sleepio, and there's a whole host of other ones. They seem to work just as well. And I don't want to read all the science. This is just showing that it's been studied for people that have gone through cancer treatment as well, and it's been shown to be effective. It's been shown to improve our mood, our fatigue, our cognitive improvement, even in the cancer setting. And it's been shown, because the program usually is only 5 to 8 weeks, that the benefits are durable over time, up to 12 months or more. So I would say CBT insomnia, if you're struggling with sleep, would be a great option for most of us. exercise, right? And it may take some time to get the benefits of exercise to improve sleep, but it will definitely make a difference over time. You want to aim for 150 minutes, ideally, of aerobic exercise per week. Less evidence, but I'm still going to share it. There's a couple of small studies that bone broth, which is rich in collagen, may be helpful. Why is that? Collagen is rich in an amino acid called glycine, and it turns out that glycine may help the production of melatonin, which also helps facilitate sleep, and glycine helps our body temperature drop at night, which may facilitate sleep. So you can get glycine, naturally through cooking bone broth, or, some people choose to get like a collagen powder that is about a third glycine and also has a good amount of glycine within collagen powder. So that might be, again, less evidence than the things I just mentioned, but it might be another tool in the toolbox. And then, we could spend time thinking about all kinds of other strategies, from acupuncture to yoga to meditation. These are the kind of things that you have available to you at your cancer support community, right? And we know that hypnosis and mindfulness and music therapy, or just spending time in nature, and all these things can be helpful for some people. And we just have to be a little conscientious about, experimenting with some of these strategies. And if I were to summarize, and this is my final bit, the tips for healthy sleep. Number one, especially when you're not in active treatment, when you're done with that rigorous part, you want to try to get back to a schedule, including the weekends. I hope I reminded everyone to avoid caffeine in the afternoon, because it really could take 8 hours to really wear off. I didn't really talk about this, but alcohol, I know it helps some people fall asleep, but the quality of the sleep for most people is not as good because it reduces REM, which is important for restorative sleep. So I would be careful about that if you're struggling. Don't take naps after 3, because again, it may impact negatively the sleep inertia that we want at nighttime. And I didn't really talk about this, but it turns out a hot bath may be helpful for many people. One, because it's part of the wind down and relaxation period that we talked about. But two, physiologically, when you take a hot bath, right, your soft tissue, your skin gets really hot. So your core, right, has to cool down to compensate for that heat on your periphery. And cooling down your core, it turns out, it helps facilitate the sleeping process. And for the same reason, I would argue, sleep experts will argue, that most of us are overheating our homes, right? We want it 74 degrees in the summer, 74 degrees in the winter, 74 during the day, 74 at night. That's not how we were wired ancestrally to live. And it turns out cooler temperatures at night, many will argue around 65 degrees, anywhere from 62 to 67, probably is more optimal for the sleep process for most of us. And then finally, for the reasons that we talked about, you don't want to lay in bed awake for more than 20 minutes. Because if we do, that's when we risk developing those negative associations where we put our head down on the pillow, and that's when we start having those racing thoughts, because we did that the previous week and the week before that and the week before that. And then after a while, that neurologically gets wired to us. So we want to avoid that association. So I know it takes discipline effort, but if you're up for more than 20 minutes, try to go to the kitchen or living room and get the thoughts out there, and then only come back when you feel like you can fall asleep. So with that, I'm going to conclude. I'm going to end by a wish for all of you. I dreamed I got 8 hours of sleep. I know it is hard to optimize our sleep as best as we can. But again, in my heart, I believe that sleep is our birthright, and we should try to do what we can to give us a gift that not only helps us feel better, but I hope I'm also made the case that it may also have important biologic implications for our mental well-being and with increasing evidence, possibly for cancer biology as well. I thank you all so much for your attention. And if we have a couple of minutes, I'd be happy to take any questions or comments in the chat.
Great. It looks like there are some questions here. I don't know if you answered this first one. Noel says, what is your opinion on melatonin supplements? I think you may have mentioned that.
If I think it's worth expanding for a moment, and I think there's a couple of thoughts. So number one, if the goal is to use melatonin for sleep, your brain will naturally make melatonin if we do what we talked about. Get natural light during the day, couple that with darkness at night, make sure we have enough glycine, which we can get from bone broth and other sources in our diet. Your brain will make melatonin naturally. I sometimes worry about long-term melatonin use. I use it when we're jet lagged, so when we need it for 3 days to reset our clock. I think it's useful that way. Now, I will say, and I don't really want to get into this now, there are a number of studies that are where people are using higher doses of melatonin for its anti-tumor effects, including for breast cancer and other cancer types. That I think, and these are like higher doses of 10, 20 milligrams. Normally, when we use it for sleep, we use 1 to 3 milligrams typically. That I really want you to talk to your doctors to decide if that kind of more alternative treatment is worthwhile or safe for you or not. Good question,
Okay.
though.
Great. Okay. Next question says, I've just finished my treatment and I sleep during the day. How long after a 6-month treatment does it take to recover from excessive fatigue?
That's a important question, a hard one to answer because there could be so many variables at play, and we know the first, depending on what kind of treatment you had, the first 6 to 12 months I would view as generically speaking as a time for natural recovery from the rigors of whether you had surgery, chemo, radiation, bone marrow transplants, etc. But I would say it's still worth employing some of the strategies that we talked about, which is, again, as long as it's safe for you and you don't have a skin condition or an eye condition, to start getting some natural light during the day and darkness at night, because that will help start to retrain our clock. And if it's safe for you, and it is for almost everyone, to start going on some walks and to get some gentle exercise to try to rebuild that fatigue and energy. It is a long haul oftentimes, so I do empathize with that.
Okay, great. And now there's a question here or a statement here. I do use aromatherapy at the hospital with patients, and we have great results with lavender and bergamot.
Yeah, I think aromatherapy, it can be another great tool for many people. I would just caution for lavender, and lavender has been studied for anxiety, particularly when it's used through a dispenser and it's part of something that we're inhaling. There's a concern with a couple case reports that I came across that if you rub lavender oil all over your body, it may stimulate breast tumor growth. So if you are a breast cancer survivor and you have estrogen sensitive cancers, I would suggest not rubbing the stuff, lavender oil, all over. But for aromatherapy, I think that would be a perfectly reasonable option.
Okay, good information there. Let's see. This next question says, is there strong evidence or studies about sleep meds and cognitive decline?
It's a great question, and it's one of those things where there are two camps. And I used to think before I went to medical school that that once I went to medical school, it'd be black and white, and we'd have these agreements on all the important issues, and it's not really true. So there's an argument that some people are worried that medicines like Ambien, Xanax, and Ativan, and so-called benzodiazepines and other sleep medicines are associated with cognitive decline. The other camp argues that, people who had, let's say, dementia or early dementia, they had insomnia, and so they were prescribed these sleep medicines, and so it's an association, not causation. If you ask my personal judgment, again, I would try to use non-medication options as much as possible. But if we've tried everything and it's not working, I think it's, again, a reasonable option to consider medication options. But you're right, there is this debate in the medical field of sleep meds and cognitive decline. There's an argument in both arenas, so I don't have an easy answer.
Okay, thank you. Let's see, we've got a question here. I have both insomnia and sleep apnea. Do I need to fix my insomnia issue before I can fix my sleep apnea?
Good point. I think it's the other way around. I think if one knows that they have sleep apnea, and by the way, it's a great point because if you know that you snore or wake up with a morning headache, or if your partner sees you, having these micro spells where you're not breathing for a half second, it's worth getting tested for sleep apnea because that's treatable. Weight loss can help. CPAP machines, of course, is the standard of care. There's certain exercises that speech therapists can sometimes offer. So I would argue if you know that you have sleep apnea, I would try to optimize that first and then come to some of the other things that we were talking about.
Great. Okay, here. I don't see any other questions. Do we have any more questions for Dr. Asher? I actually had a quick question for you. When you were talking about caffeine, I know one of the hidden areas where there's caffeine is actually in eye serums and, creams that go around the eye that are caffeine-based topical ointments. And I'm curious, is caffeine safe to put on the face? I imagine it's absorbed by the skin, but I'm just curious about that.
That's a great, I wasn't even aware of that. So there's caffeine in topical eye creams.
Yes.
Okay, you gave me something, you gave me some homework to look into. I was not aware. So I don't know.
Okay.
I wonder
But
why.
I use it. I used it. So circle back around. Tell me if
But
that's
but
okay.
why do you know why they put caffeine in the eye creams?
Yeah, so it helps with reducing dark circles, and also it helps to sort of brighten the eyes and
Interesting.
yeah.
Okay,
So
I have to look into that.
okay. I see someone put in a question, edibles question mark. Any comments
Yeah,
regarding?
edibles, and by that for the group, we're referring to either CBD or CBD with THC or some combination thereof. And if you look at expert opinion papers, they'll say it's mixed. Again, some studies seem to suggest that it may be helpful for some and others don't. I would argue it's not without its own side effects. I've had some patients that seem to do great with it, and it seems to just help with anxiety and sleep, and other people that have had, disorientation and dizziness and other side effects. So like most things in medicine, I think it's worth thinking about that on a trial and error basis and just see how you respond on an individual level.
Someone put a comment in here. I have sleep apnea and delayed sleep pattern syndrome. Any thoughts or comments on that?
Just with that pattern, I think it's worth to work with a sleep specialist, which I suspect this individual is doing, I assume, if they have those diagnoses. But for the delayed sleep pattern syndrome, if one wants to work on that, again, I'm going to come back to the same theme, beginning to expose yourself to light earlier and earlier in the day. And then that's when some people might use melatonin at bedtime to start shifting the clock might be helpful.
Okay, good. Let's see. I don't see any other questions here in the chat box. So, Dr. Asher, I really want to thank you for your time and your expertise, and you really do a wonderful job at breaking everything down in a way that we can understand so well. So again, thank you for your time.
Okay, my pleasure. Thank you all for joining.
All right. Sleep
Bye-bye.
well, everyone. Good night,
Okay.
Dr. Asher.
Wondering if everybody could just stay a minute to take the poll.
Oh, that's right. I'm so sorry.
Thank
Let's do that. Can you all stay on and finish the poll that'll appear on your screen?
Okay, launched it.
There. Yep,
Okay.
we see it.
Okay, great.
Thank you all. Good night.
Thank you.
Thank you,
Good night,
Dr.
Dr.